Health officials in New England are warning residents about the rare mosquito-borne eastern equine encephalitis known as triple E.
It is a mouthful. Some parts of Massachusetts are spraying for mosquitoes to lower the risk. Just yesterday, New Hampshire recorded its first death from the virus since 2014. 41-year-old Stephen Perry's family says he died after a week-long hospitalization.
Now, this mosquito-borne illness can cause flu-like symptoms. It is deadly for about a third of people who develop it. The threat usually subsides with the first frost of the year, which puts mosquitoes into hibernation.
Dr. Waleed Javaid joins us now. He's a hospital epidemiologist and director of infection prevention at Mount Sinai Downtown here in New York City. Great to have you with us. And we know you don't want to scare people too much, but this is so serious. Are the pattern of cases so far typical to what we normally see over a summer, or is there an added level of alarm right now?
So it's not unusual. We do see around this time of the year, we do see people, very few people across the country get infected with Eastern equine encephalitis virus. And then the mortality or the death rate is about 20-30%, which unfortunately in this case was the result. But this mosquito and this disease does occur in the eastern part of the United States.
And we mentioned the risk will ease once the weather cools down. But right now, people are actually really scared about this, especially since everybody seems to be getting mosquito bites. We're looking at spending a lot of time outdoors, at least for the next couple of days. So who is most at risk? And given that for a third of people, it's actually deadly, at what point, if you get a mosquito bite and you have some of these flu-like symptoms, should you be concerned?
So I think, and all those questions are very, very important. I think prevention is the best cure in this situation, where we can actually prevent mosquito bites. We can prevent them by using insect repellents, especially if we are going to the woods or to hiking. I think the best practice really would be if people are out and about to make sure that they are using some sort of protection from mosquito bites themselves. And then people who are high risk, elderly usually are in this category. But this virus in itself, again, being very rare, has occurred in younger individuals as well, although the risk of death is higher in the elderly.
All right, Dr. Javaid, thanks so much.
Thanks, Doc.
Thank you.